GRAS programme, it stands for Graded Repetitive Arm Supplementary Programme. Karen Bevan, the occupational therapist, and I found that we had a lot of duplication with people. So we were getting the same referrals, we were overlapping in our treatments, and sometimes it was hard on people because they were getting two varied approaches and two home exercises programs, and that could overload them at times. So Karen and I put our heads together, we did a lot of research, and we saw that the GRASP, the Graded Repetitive Arm Supplementary Programme, was a very good treatment programme for people with upper limb deficits. They feel supported in two ways. They feel supported by the therapists, because there are 2 therapists per 6 people, and it's 2 approaches, so it's physiotherapy and occupational therapy, but they really feel supported by each other. For a lot of people, when they get their stroke or their acquired brain injury, or they get their multiple sclerosis diagnosis, it can be life-changing for them. So they can feel very isolated, so they feel very supported in the group.
So the GRASP programme is an upper limb programme that we introduced for people who have had a stroke or a brain injury or a neurological condition. So it's an upper limb programme that involves strengthening, coordination, stretching activities of the hand and arm. So the activities range from larger range of movements, so shoulder range of movement, hand coordination, hand strengthening, stretching and arm strengthening. So we would assess people before and after the programme, and we would see an improvement in both the use of their hand and their confidence in the use of their hand. So I think that kind of translates into a big day-to-day benefit to people at home, and it's something they can continue on at home afterwards. It's very positive. I mean, myself and Teresa put a lot of work into setting up the programme. It's nice to have it acknowledged, and it makes us feel, I suppose, valued as part of a team.
I was seconded over to Clonfanon to move 29 residents and 2 respite residents to new community houses. The project began back in 2014 with the discovery process, and it finished in 2019 with all residents moved out to the houses. The impact that it has made on the residents is absolutely amazing. One of the main things that we can see is that families are visiting a lot more, which was something that wasn't done when they were in the residential setting. Also, the residents themselves have choice. You can see them come into their own, you can see their personalities emerge as they experience new adventures and things that we really had taken for granted. So it's a wonderful project, and wonderful for all of the residents who have really gained major independence since they moved out. I think nobody thought that it would be possible, because I suppose what happens is that when people are in residential settings for a long time, they actually lose their identity and ability. And I think people tend to feel the same way, that they can't manage. But with support and with training, it really came into the fore that all of these residents were quite capable of moving out. But for me, it was just wonderful to actually get the opportunity to see the project through from the start right through to the finish, which is something that you may not get. And for that, I'm really grateful that I was able to see it through, and see the families now see as well how wonderful it is for their relatives to be out there, because there was a lot of doubt as well from the families as to whether their relatives would manage in the community. I think for me, it's not really for me, it's actually for the residents that moved out, because I suppose for a lot of staff, they didn't have faith in them, and I think you have to have that belief that people can achieve, and I think the award would actually cement that really in saying that they have done it.
We've developed my urinary catheter passport. The group consisted of public health nurses, continence advisors, and infection prevention and control nurses. We worked at developing a record that the patient would hold, and it would be a record of their care throughout their healthcare journey. We did this in consultation with people from the acute services, so we worked with consultant microbiologists, consultants and clinical nurse specialists in urology. We also worked with practice development to develop the document. The passport is important for people to have so that the correct information is with them, and this will help to ensure that they receive the best quality care that we can provide to them and ultimately reduce their risk of infection. So the passport should be started wherever the person has the catheter initially put in. It's a record of when the catheter was put in and why it was put in, and it also gives information then on the equipment that the person would need to look after the catheter. It gives the patient information around what a catheter is, how they need to look after it themselves, how their family might look after it, or if they're supported at home by someone such as home support assistant, it'll be information for them as well. We're passionate about this passport and passionate that it will improve the quality of care for the people in the community that have catheters.